My name is Cecilia Brenner and I'm the Experience Design Director for our Digital Marketing and E-commerce program at the Amsterdam studio.
My name is Carl Megens. I'm a data designer at the Data-Enabled Design team here in Eindhoven.
My name is Jeroen de Bruijn. I'm an experience designer for Philips Design. Mainly works for image-guided therapy right now.
So we were back in March. This was March 16th. It was the lockdown day in Holland. 4 days later, I got this call. This call that says, Cecilia, you need to fix a team, and this team needs to work on a solution for at-home monitoring of COVID patients. But there is one challenge. You have 5 days to launch it. I didn't have to think twice to pull in a team, because I knew that this is what you live for as a designer, to improve people's lives, even from your living room.
Yeah, so what we're trying to do with this project is actually lowering the pressure on emergency departments and GP departments.
And well, our customers, the hospitals in this case, really needed to prepare for what was coming and get a grasp on how big is this, how fast is this going, what's happening. So no testing capabilities, and yet you still want to know from a full population, how are they doing and what can we expect? How many of these people who we treat now as patients are coming to the hospital with COVID-19?
For me, it was, and for Jeroen and the design team, we were talking about it also, like it's almost to design it for yourself, because we all sit with these kind of questions. Do I have the symptoms? What are the symptoms? When do I need to go to the hospital? Do I need to go to the hospital? So that state of mind was very real.
Yes, there's a lot of time pressure, but then again, it's so about the actuality and the pressure you feel from COVID yourself. And the thing was that we were working in a team where one of the persons actually is in a vulnerable group. So he felt the pressure even more. And it was like, okay, we're in this together. We need to make this a real good experience, because for him it was so important that he could use such a tool and be sure that he didn't have COVID or he didn't have to go to hospital. So it makes it really tangible.
When doing something in a week, you have bought yourself no time at all, and you need to make decisions from day one.
Luckily, we already had a sort of a system that we could reuse for this purpose. So the Vital Health system is basically a survey tool that we sort of reversed to a survey tool for COVID.
What we created was a dashboard, a screening tool, with on the one hand a screening tool in which all of the data of all patients goes into the screening tool, and there you can see which patient is at risk.
And you are categorized in 3 areas. One is where you don't have any symptoms, so you don't need to take any action. Second is the mild symptoms, where you actually are saying, okay, you have mild symptoms, stay at home. And we will monitor you and guide you and track your health. And the last one is you're at high risk. Please go to the hospital. From the first launch with the Groene Hart Ziekenhuis in Gouda in end of March, we're now in August, and we have scaled this solution to 310 hospitals in Europe. And it looks like we will continue to scale also in South America.
What am I most proud of? That we were able to do it, and that we're able to step up and step up to the challenge and actually get it done.
The key quotes that came back after using this solution is that they felt reassured. They felt like it's nice to have someone looking with them behind their shoulders. And that's also what we said. That's also what the solution should stand for.
Having an impact and doing that as a designer for such a alarming situation, that's what you do it for.